Hello there, and welcome back to the Freshwell Low Carb Lifestyle Programme in association with the Colne Valley Primary Care Network, comprising of these GP surgeries. So, as you know, just a quick recap, this is a 6-week course with a health coach supporting you along the way and is going to be presented by myself and Dr. Oliver. I'm Dr. Kim Andrews. I've worked at Freshwell Health Centre for 17 years and have discovered the low carb lifestyle along with Dr. Oliver more recently. And as Dr. Oliver says, I'm the one with the hair. And just again, as a disclaimer, please don't take this as medical advice. You should always check with your own doctor or nurse before starting such a big dietary change, especially if you have any long-term health conditions, and that's particularly if you take medication for either diabetes or high blood pressure. If you're able, do monitor your blood sugars and your blood pressures at home, and then that will alert you to any issues earlier on. And it's important to speak to your doctor because you may need to reduce your medication. So just as overview of the modules, we are moving on today to module 2, which is knowing your numbers and more about carbs. Do you know your numbers? We're going to talk today about values including your weight, your body mass index, your waist size, your blood pressure, your fasting glucose, and your HbA1c, which I'll explain more about later. Also cholesterol and triglycerides, and this one I think a lot of people get concerned about, but we'll talk about why you don't need to worry about that a bit later on. And liver function tests are the other one that we talk about that people don't often think about as being a problem with our underlying metabolic health, and we'll talk a bit about that later. Why know your numbers? First of all, this is because this is your health and nobody else's. This is about what you want to benefit and where you are at the moment. It might help you understand a little bit more about the science behind why we believe a reduced carbohydrate lifestyle is beneficial. And it may also reassure you in some respects, as a lot of people have been told their whole life to eat low fat and that fat is dangerous, you know, eggs are dangerous, cheese is dangerous, but actually knowing your numbers will give you the personal evidence and reassurance that lower carb, higher fat does not tend to adversely affect your blood cholesterol, and in fact it often does the opposite. And I think knowing your numbers also helps to motivate you. When you can see that benefits are being made, that spurs you on to keep going and achieve more. And alongside with that, you can monitor your progress along your journey. So firstly, talking about body mass index, most people have heard about this. This is calculated as your weight in kilograms divided by your height in meters squared. A high BMI is associated with poor health, but not always, as we'll talk about. If you don't know your BMI, you can Google BMI calculator, put in the numbers it asks you for, and it will give you a number. Underweight is classed as any BMI less than 18.5. Normal weight is 18.5 to 25, and overweight is anything between 25 and 30. Once you get above 30, this is classed as obese. And actually there is one further category of morbidly obese, which is above 40. People in ethnic minority groups, such as Black and Asians, actually generally are considered normal weight only up to a level of 23, and anything above that tends to increase their risk of metabolic disease. There are limitations though. There are the odd people that do have type 2 diabetes but are still within a normal weight range. And people like bodybuilders that have a very high muscle mass tend to have a high BMI when actually they are metabolically fit. So let's talk about waist circumference. Waist circumference is important because this gives us an idea of the fat that you are carrying around your internal organs, and this is otherwise known as visceral fat, and it is the most damaging fat with regards to causing metabolic problems, and as opposed to being the love handle fat on the outside, this is what we call more the beer belly fat, the fat that's concentrated on the inside, and we'll talk a bit more about how that can affect your liver later. A healthy waistline is counted as 37 inches or less for men and 31.5 inches or less for women. As this waist circumference value starts to increase, you can have a much increased risk of some serious health conditions, and that's particularly for men if their waist size is more than 40 inches, and for women if their waist size is more than 34.5 inches. So this is another good one to do, which is more difficult to cheat with, to measure again the amount of visceral fat you may be accumulating on your insides. So to do this, grab some string and cut it to the same length as your height. You might need some assistance with that. Once you've done that, fold that piece of string in half and wrap it around your tummy at the level of your tummy button. And this is better to do when you are lying down. When you do that, the ends of what you want is for the ends of those pieces of string to meet or to overlap. If they don't meet together, that means that you are carrying more visceral fat than you should be. Don't cheat. So moving on to talk about blood pressure. This is really easy to monitor at home. The machines have got very good and are coming down in price, and so for £15 to £20 on Amazon or from your local pharmacy, you can pick up a pretty good monitor these days. So what is blood pressure? Well, blood pressure is a measurement of the force that your heart uses to pump blood around your body. And it is measured in millimeters of mercury, and it's given as two figures. The top number is something we call the systolic pressure, and this is the pressure of your heart forcing blood out of it to send it around the body. The bottom number is what we call the diastolic blood pressure, and this is the pressure when the heart has finished contracting and it's resting between beats. And luckily, a low-carb lifestyle can help get your blood pressure down if you need to achieve that. So this is a slide just giving a brief indication of what we consider to be a normal blood pressure. As you can see, it does step up in levels. I would personally say that there is no such thing as a low blood pressure unless it's making you dizzy and fall over, but lower the better. And ideally, I would look for a blood pressure in my patients of less than 140/80. However, in some conditions like diabetes or kidney problems, we do like that to be a little bit lower, as evidence shows the outcome is better in those cases. But once your top number is moving kind of above 150 and your bottom number is moving above 90, then that is going to start your GP wanting to make steps to bring that down. Moving on to talk about blood glucose. This represents the amount of sugar that you're carrying in your blood at any point. And in healthy people, we tend to expect that level to be between 4 and 5.5 first thing in the morning before their breakfast. And after a meal, around an hour after a meal, we would want that to be less than 8. You can monitor this home yourself, and I think it is really interesting to do so just because it can show you your response to different foods, because we are all different and some people will respond in a different way to the same food. It's useful to check after a meal to see how that food has affected you, and you can do that with a finger prick device. This isn't routinely available on the NHS, but you can buy these again from your local pharmacy or from somewhere like Amazon online, which will provide you with the machine and some starting strips. There's also a special kind of monitor called a Freestyle Libre, and this is a sticky pad that you can stick onto your arm, and then you can download an app on your phone to swipe that sensor, and that tells you what your blood sugar is at that time. The benefit of that being that you can do it multiple times a day without having to keep stabbing your fingers, and it can be really interesting, the results it shows you. They are more expensive, and a 2-week supply of sensors costs around £50, but it may be worth doing once or twice just so you can see the effects of food on your blood sugar. And as you can see there, that little chart is to just show you the use of a Freestyle Libre after eating a donut and how high that level goes up there. So moving on to HbA1c, this is also known in abbreviation as A1c, and is an indication of the average blood sugar over the last 3 months of time. If that level is below 42, you're considered to be non-diabetic. Between 42 and 47, this is known as pre-diabetes. And once you hit 48 and over, that is diagnostic of diabetes. Sometimes in different countries, they do express this in different values, so the numbers aren't always comparable, but that is how we do that here. So moving on to talk about fat or lipids, and the main one of those that most people have heard of is cholesterol. This is about the amount of fat that you are carrying in your bloodstream, and is quite a complicated and controversial subject. There previously has been a lot of vilification of a particular subtype of cholesterol called LDL, which has been indicated to cause problems like heart attacks and strokes. But there is new evidence coming out which heavily suggests that that may not be the case after all. So currently, we're generally told to aim for a total cholesterol of less than 5, and we aim to get that bad LDL cholesterol less than 3. However, we believe that some other markers are more important. First of all, what is your good cholesterol? This is your HDL cholesterol, and we want that value to be more than 1. And it is that ratio between your total cholesterol and your good HDL cholesterol which is really important, and we want that target to be less than 4. And triglycerides, another fat particle, are becoming more important than we previously thought, and when you're having a fasting blood test, you're looking to have that value as being less than 1.7. And we believe that actually the HDL, the ratio, the triglycerides are the most important things to look at here, and not just your total cholesterol and your LDL. So now let's talk briefly about liver function tests. As you can see up in the corner of the picture there is a picture on the left of a lovely, healthy, shiny, glossy liver, and on the right is what we call fatty liver. And that's when I talked about earlier about that visceral fat coating your organs, and it starts to affect the cells of that liver, and it starts to malfunction and not be able to work the way it should. It's really common. Probably around 25% of adults in the UK are suffering with this, and most of them really have no idea. And fatty liver is a risk factor for many conditions, including heart disease and type 2 diabetes. But it can be reversed with low carb. And quickly is the other comment I would make on that. So in terms of the figures we look at, there is a value for ALT, which stands for alanine transferase, and we like that to be less than 50. And also another enzyme called gamma GT, gamma glutarate transferase, and we like that level to be less than 55. So let's just take a little moment to have a look at one of our patients at the surgery at Freshwell Health Centre. So this chap presented with abdominal symptoms initially, and we found him to be passing a lot of sugar in his urine. So we went on to do some tests, as that can indicate a problem with blood sugar and diabetes. As you can see, he presented with his HbA1c way up, 115, really very, very high. And if you can remember, normal is less than 42. The patient decided he really wanted to adopt a low-carb lifestyle and did not want to take any medication at that stage. And in just 4 months, he managed to get his A1C down from 114 to 41, which, as you know, is a sign of a normal blood sugar. So he did that all himself, just using a low-carb diet. And his weight also went down from a starting point of about 100 kilos down to about 85 kilos, bringing his BMI down from an obese 32 to a slightly overweight 27. But that's a magnificent achievement. Now let's look at the same patient's liver function tests. So as you can see, when he first presented, his ALT was back right up at 65, above what we consider normal at 50. And after just 1 month, he brought that down to 20, well within the normal range. And the gamma GT on presentation, again above the normal of 55 at 70, in just a month came down to 20. So as you can see, a low carb approach will rectify a fatty liver extremely quickly once you allow the liver to get rid of that fat. And finally, just looking at his lipids, his cholesterol and triglycerides. As you can see, initially they were very high at above 4 when the normal is considered to be less than 1.7. And again, within just 1 month, that came rocketing down, so that's under 1. And as you can see, the graph on the right shows his ratio of total cholesterol to good cholesterol. And that was initially very high at 5.5, but came down again to 3.5 within just 1 month. Pretty impressive, I think you'd agree. So, do you know your numbers? And how are your numbers going to change over the next 3 months as you work on developing a low-carb lifestyle? So, how can we see these improvements in our own numbers? Let's just recap the low-carb lifestyle that's going to help you achieve this. 4 simple principles. Minimize sugar, minimize starchy carbohydrates, eat real food and avoid processed food, and don't fear natural fat. So let's talk about sugar. Try to eat as little as possible, and we're not just talking about adding white table sugar to cereal and cups of tea. We're talking about processed food, packeted food that has multiple ingredients on the back. We're talking about puddings, cakes, biscuits, soft drinks. And don't forget also that fruit juice, smoothies, and some fruits in general contain a lot of natural sugar, which we want to try and avoid when possible. So going back again to Dr. Unwin's sugar infographics, remembering that starchy carbohydrates are just made up of lots of glucose molecules holding hands. So when you eat that starchy carbohydrate, it works its way into your system and breaks down into those glucose molecules. And that's shown here. As you can see, a portion of basmati rice contains the equivalent of around 10 teaspoons of sugar once it's within your body. A boiled potato contains around 9 teaspoons of sugar. Pasta, around 6 to 7 teaspoons of sugar, and a small slice of wholemeal bread, around 3. And just as a reminder, when we're talking about reducing starchy carbs, we are talking about bread, we're talking about pasta, potatoes, breakfast cereals, which would include porridge oats, and rice. So just looking at one of those, breakfast cereals. In my mind, breakfast cereal is really dessert and is a really poor start to the day for anybody. I think we would all appreciate that Cocoa Pops aren't particularly good for you, but as you can see there, you know, a small bowl, and that's the other thing really, the serving size there is 30 grams, and I would say most of us probably have at least double that. But Cocoa Pops, a small portion, about 7 teaspoons of sugar. But if you look, actually cornflakes are even worse, at 8.5 teaspoons of sugar. and what we might consider to be a healthier cereal, things like shredded wheat, bran flakes, still contain between 4 and 5 teaspoons of sugar per small portion. And interestingly there, just see on the bottom, oat porridge is there, that our old favourites that we've believed for years is magnificently good for us. But as you can see on there, a bowl of porridge contains around 4 to 5 teaspoons of sugar. So, sorry, it's got to go. So, which breakfast is better? This slide demonstrates the effects on blood sugar of two different breakfasts that somebody could have. So if we have a look at the bottom red line, that shows the blood sugar effect of some Greek full-fat yogurt with some berries and some homemade granola. And the top blue line shows us the effect on blood sugar of wheat biscuit cereal. So as we can see, looking at the bottom line with the yogurt, the blood sugar starts at around 4.3, gently rises to about 5 and very quickly comes back down to baseline, producing a very smooth blood sugar and very little in the way of a blood sugar spike. If, however, we look at the top blue line indicating a wheat biscuit cereal, the blood sugar starts at 5.4, but quickly rises to just under 8 at 7.9, and then slowly comes down over the next few hours back down to baseline. So you can see that really the blood sugar elevation when consuming a low-carb breakfast such as Greek full-fat yogurt is way below that caused by having a wheat breakfast cereal. And interestingly, if we have a look at the food traffic light system on the boxes of most breakfast cereals, these seem to show a full green spectrum indicating that this would be a recommended healthy breakfast to start the day. But we hope that by looking at this graph, you understand why we don't think that that is the right thing for any of us. And interestingly as well, just looking at this small graph, it shows you the blood sugar spike when consuming a donut, which I think most of us would expect. But it's interesting to see that food groups such as wheat biscuit cereal, a banana with 2 satsumas, or a portion of beans on wholemeal toast can also cause the blood sugar to rise as high as, if not higher than that caused by consuming a donut. And I think for a lot of us, that's quite an eye-opening thing to see. Talking about bread, this is another favourite for a lot of people and one of the things they find hardest to give up. And as you can see, most types of bread contain between 3 and 4 teaspoons of sugar per slice. And obviously we need to think about other bread types as well, like pita breads, wraps, you know, they will have the same effect. We always used to think that picking sort of the brown, the wholemeal option would be better. And yes, there is more bran, there is more fibre in those brown alternatives, but actually the effect on blood sugar really is the same. So with regards to bread, by all means try making your own. We would suggest that you're wary of shop-bought keto or low-carb breads, as these are often moving into a processed category of food with lots of ingredients. If you can, we would recommend that you make your own. And on our low-carb website, there are some recommendations of things that we have found that we have enjoyed. There is a fathead dough recipe in my meal planner, and one of our favourites is also the keto coconut flour hamburger buns that you'll see there on the right side. So going back to breakfast, what some people may have had to eat previously for breakfast. So a bowl of bran flakes with some semi-skim milk, a slice of brown toast and some apple juice. As you can see, that in itself gives you a total breakfast of 16 teaspoons of sugar. And that is obviously a pretty bad start to the day. Fruit juice. This is a particularly bad thing to get your morning going. And that small 200 ml glass of fruit juice there is nearly the equivalent of 9 teaspoons of sugar. And if you can remember from the first session with Dr. Oliver, this sounds a little bit familiar because it is about the same as what you would find in a can of full sugar Coca-Cola. Anyone fancy Coke for breakfast? Moving on to fruit and veg, and I think what we really want to do is make people understand that they are not the same. and we can't bunch them all into one category. So we know that those starchy vegetables like potatoes can push our blood sugar up, but the sweeter vegetables like sweet corn can also do that. And looking at fruit, tropical fruits generally tend to push sugar up much higher, as do dried fruit. And as you can see there, raisins really particularly high. So really best to avoid any form of dried fruit, and tropical fruits ideally. Sticking to fruit that grows in Britain, so tends to be sort of apples, plums and berries. So 5 a day, I'm sure we've all heard of this. We've all been encouraged to consume fruit and veg 5 a day. But actually this really isn't based on evidence at all. This is something that's been pulled out of the bag, presented to people as something that they should be doing. And it's very, very simple. It's simplifying something that's actually a lot more complex. And in a lot of people, particularly I think for children, it encourages the eating of lots of excess sugary fruit, which is pushing up your blood glucose. And as we've always said, how can we equate 5 portions of pineapple to 5 portions of broccoli? It just doesn't make any sense to us. So we think the 5 a day is out. Looking at different fruits, as I've said, you want to be avoiding those tropical fruits, bananas, grapes, pineapple, mango. These are going to really affect your blood sugar. And you want to be sticking to UK grown fruit. So that tends to be berries, strawberries, blackberries, blueberries, and also would include sort of apricots, nectarines, peaches, and the occasional apple and pear. So talking about healthy whole grains, we are generally told that eating the brown or wholemeal equivalents is better for us. And in general, yes, I would agree that that is true if we had to pick between one or the other. But actually, as you can see from this slide, there is as much sugar really in white rice as there is in brown rice, and so forth for white bread, brown bread and pasta too. So really switching to the wholemeal alternative will give you a little more fibre, but the effect on your blood sugar is the same. So how else could we get fibre into our system? Well, certainly better sources of fibre from our point of view includes lots of vegetables. And as you can see from this slide, starting on the left side of the slide, they have the fewer carbs in, and as we move across to the right, they have more carbohydrates. So, leafy veg, cucumbers, cauliflower, aubergine, they're all fantastic vegetables to be filling up on and getting your fibre. And then just try to keep some of the carbier veg, particularly root vegetables, try to keep those to an absolute. So this is a very busy slide, but it might be something worth keeping by for a quick shot for you to see actually, should I be eating this or not? Essentially, it gives you a traffic light system. The red things on the right, things we really don't want you to eat much of at all, if any. Things within the middle on the amber are things you can enjoy sort of 2 or 3 times a week. And then the green things there to the left are things to enjoy liberally, plenty of throughout the week. And there's lots of good stuff on there. So this slide, again, just indicates the high carb value of root vegetables, which often particularly tend to be high carb. So yeah, we would generally recommend that you avoid potatoes and sweet potatoes and parsnips, and maybe enjoy a bit of celeriac, a bit of carrots as lower root carb options. But again, that should be every now and again as opposed to on a daily basis. So in conclusion, what we want you to do is we want you to eat real food, non-processed food, reduce starchy carbs, but concentrate on those healthy fats that are not going to negatively affect your blood cholesterol and that are going to keep you really full and going until your next meal without need to snack. So finally, I just want to give you a little personal point from my point of view. And for me, this was really what opened my eyes to a low carbohydrate lifestyle. This is my dad. My dad is 70 years old and has pretty much been overweight for the majority of my life. He's tried every diet going, Slim Fast, Weight Watchers, cabbage diets, soup diets, and you know, he's always lost weight, but within a year it's always climbed back on again. So to the left is my dad in January of 2019. He's weighing in at 103 kilograms, giving him a BMI of 32. And at that time, he was taking 2 blood pressure medications and also a statin for his blood cholesterol. I recommend that he try the low carb diet, as I thought, you know, this is a man that likes steak and red wine. He might be able to do this. And within 6 months, this is where he got to, which was absolutely astounding for me. He's there in those pictures weighing in at around 82 kilograms, which is a loss of 20 kilos, and his BMI down at 25, which is, as we know, is the top level of normal. I'm pleased to let you know also that 18 months down the line, he has not in fact kept all that weight off, but has in fact lost slightly more. He's now weighing in at 77 kilograms and is on no medication at all, and is cycling around 50 kilometers a couple of times a week. So he is loving life, and it's so great to see him finally comfortable in his own skin, not having to calorie count, not having to be concerned about his weight. You know, he is in control of his appetite and of his future, and it's been really marvelous for me to see, and has been one of the things that really has spurred me on to get this message out to people, because if my dad can do this after 70 years of being overweight, then that opportunity is out there for everybody. So we'll see you again next week. Next, the module is going to be entitled Shopping Low Carb in a High Carb World, and we're going to be looking at some food labelling to help you make the right choices when you're in the supermarket. Thanks very much for watching. I hope you enjoyed it, and we'll see you next week. Good luck.